Good story. Welcome to the TelePT Connections podcast. I'm Daniel Seidler,
I'm Adrian Miranda.
and our special guest today is Lydia Zeller. Lydia is the CEO of Kiio, a provider of digital musculoskeletal solutions sold B2B to health insurers and large employers. Welcome, Lydia.
Thank you so much. Great to be here.
Great having you here. So let's get right into it. Tell us a little bit about yourself. Tell us a little bit about Kiio, and Kiio is Kiio, in case anybody's wondering.
Yes, indeed. So as you say, Kiio is a provider of digital musculoskeletal solutions. We are on-demand software delivering care. So this is AI-based delivery of personalized care programs specific to the subset of pain within the particular joint, guiding members through exercise, education, and then the ability to connect with a human being if they so desire. But it's not TelePT, so it's complementary to TelePT. So we are not one-on-one PT with connection with the member, but it's programs developed by physical therapists then being delivered by software. Cool. I joined Kiio kind of early in our history. We actually began in an adjacent space developing hardware and software solutions for physical therapists. So selling into the provider market. And made a change in the beginning of 2017 into digital solutions being sold to health insurance companies and employers. Prior to my current role, I was product strategy. So I kind of spearheaded our pivot in 2017 and have had the great privilege of signing our first clients, getting our validation studies underway, and really proving out our outcomes, and then moving into my current role and having the chance to really build a great team and grow the business.
Got it. So Kiio was doing, I'm going to ask you in a second what Kiio was doing, and I guess also what made you change. So what was the shift? Was it always musculoskeletal?
It was always musculoskeletal.
Yeah.
So and really the shift was in the product. So previously in our original incarnation, we were providing the software that enabled physical and occupational therapists to do precise muscle deficit quantification, looking at various metrics with the sensor, pull that into the software, kind of track progress over time, and then pull together a very customized home exercise program, deliver it to the remote, usually to the mobile device of their patient, and then get feedback back remotely, update the plan of care remotely. Really the genesis, and I'm curious your thoughts here, because things have certainly evolved since, 2016.
Sure.
Really, we were looking at similar to you, new care delivery models, how to really reach many people, to deliver evidence-based care really in at scale, right? And then also looking to align economic interests. And as you know, healthcare in the United States at this point, and certainly back 5 years ago, but still to this point, economic interests are not always aligned, right? Under a fee-for-service business model, economic system.
Sure.
In healthcare.
Yep. Are your, to skip ahead a little bit, are your contracts, are they not fee for service? Are they value-based type contracts? Is that?
Yeah, they're all utilization-based. Some are fully value-based, fees at risk, et cetera, but we're only paid when somebody engages with Kiio. Yeah, we don't do PM or that type of model.
Got it. So what made you shift? What made you change and essentially it sounds like your company was developing a software, right? That was being used by PTs in the clinic, and something happened to make you change to be more of the provider in a way, right? Like your software actually is providing the services now.
Correct. The software is actually providing the services. Yeah, really two different things. One is we were, to be frank, under the previous business model, we were reducing top line revenue for providers because we were reducing the number of in-clinic visits.
Problem.
a problem. That's what I meant by looking to align those economic interests. And things are shifting in value-based care. But secondly, really looking at what we were doing then is really, this was not TelePT, right? This was enabling brick and mortar physical therapists to be able to deliver home exercise programs to their patients. But that it really is a different model. So it was really that one-to-one. It was not at scale. So we were looking at how do you really take advantage of new care delivery models? How do you marry the power of technology with evidence-based care, behavioral economics, et cetera, to really move the needle in healthcare?
Sure. So now your clients are typically employers or payers, right?
Correct.
Correct. And how are they utilizing your service, the software? Is it in a strictly automated utilization, or is it some sort of hybrid model?
Yeah, so we are offered to the members of our clients as a benefit under their health plan.
Okay.
First dollar coverage, even under a high deductible plan, qualifies as preventative care. So Kiio will do an outreach campaign, and really it's a first line conservative care option, right? So we view ourselves as similar to PT in that you're going to get better outcomes if you engage with a solution like Kiio, or you engage with PT first, as opposed to hitting urgent care, going to your primary care doc and kind of getting sent
X-rays,
into that
MRIs, injections, and whatever else happens after that. Yeah.
Exactly, that escalating pathway.
Yep.
So Kiio will outreach to the member population. We do a kind of a all year long multi-touch, multi-channel awareness campaign to make members aware that they have this benefit. Hey, if you've got musculoskeletal pain, you've got this benefit. Click here to engage, and then we take it from there.
You do the marketing.
We do the marketing.
Okay, I got it. And it sounds as if it is. I mean, it's a form of preventive care. It definitely is wellness. You're looking to solve problems before they occur, or prevent problems, essentially.
Prevent problems, or prevent problems from escalating, or help somebody who's had chronic pain and hasn't been able to get over it through the traditional healthcare system.
Sure. So what kind of engagement are you getting, like on a percentage wise?
Yeah, so it depends a little bit. Employer versus health plan, we'll get higher engagement rates in employers than we do in health plan populations.
Sure.
Some of that is because, employers have better email addresses, right? Health plans may only have emails for 20-30% of their population. So we have fewer channels there. In a health plan, about 10% of the addressable population, an employer anywhere between 20 and 45%. By addressable population, it would be adults who would have musculoskeletal issues.
Got it.
Is there a specific type of employer that you work with?
Those would be self-funded employers who are running their own health plan.
But like, what kind of employers is it? Is it Costco? Is it hard like
software companies
warehouses,
or
warehouses,
software
warehouses, right? Yeah.
Okay.
So we have manufacturing, we have financial services, we have retail.
Okay.
Really kind of across the spectrum. Because as you well know, musculoskeletal issues are going to occur across the workforce and have only gotten worse during COVID, right?
That's true. Do you do customer surveys on customer approval, or like what kind of feedback have you gotten on the system?
Right. So we do
from the end users.
Right. What we would call the members or the end users.
Sure.
So we look at outcomes in really three different ways. One is clinical outcomes. So we get, during our screening, we'll get a baseline pain using the NRS pain scale. We'll get a baseline functional measure using the PSFS, baseline on mental well-being. And then as a member engages with Kiio, we'll get updates on that. So those outcomes in pain, function, mental well-being are one set. The second is satisfaction, right? So would you recommend to a friend or family member? Was this easy to use? Did it help you learn how to manage your pain? long-term. So for example, our recommend to a friend, 92% on average, 8 out of 10 people are having improved clinical outcomes, and they're significant, over 30%. So 50% in pain, 60% in function on average. And then the third way that we look at outcomes is based on claims. So when we have access to claims data from our clients, and we've now done 4 longitudinal studies looking at claims data, we are looking at how Kiio participants in chronic populations will look at pre and post. So what has happened in claims post engagement with Kiio. This is not something we've done post-COVID, because obviously that analysis is less meaningful in the COVID era, since that has impacted claims for everybody. But also looking at what's medical and pharmacy utilization and cost in Kiio participants compared to a statistically similar group who are leveraging traditional care.
Right. So where are your strengths and where are your weaknesses? What's working and what's not working? Yeah,
absolutely. So Kiio participants definitely will see lower utilization and lower cost. And interestingly, it's not so much conservative care, but it's the more aggressive treatments and diagnostics. I'm sure really similar to the outcomes that you would get, right? So significantly lower use, exactly, of urgent care, of MRIs, of x-rays, of injections, radiofrequency ablation surgeries, opioids, benzodiazepines, antidepressants, prescription NSAIDs, et cetera. So really the stuff that you want people to be avoiding. We view ourselves as, again, complementary to PT. We do a screening at the beginning. Oh, I guess you asked about weaknesses. So, the hardest nut to crack always is that engagement. Our outcomes are dose dependent. So we have those outcomes I gave you include people who did not finish the program, but the people who finished so in our latest study, 56% lower costs, 87% lower opioid use, 90% lower utilization of urgent care, et cetera. We just did a press release on that with one of our health plan clients. That's for people who didn't even finish the program, but if you look at the people who do finish our core program, it's even better outcomes. But human nature, when you feel better, right, you may stop. Hey, my pain is lower, so I'm going to stop. I'll come back when I have a flare up. But if you can get people to stick with it through at least the main program, and then just have it available as maintenance, you're going to get even better outcomes. Sure. So that's something we are always working on.
Sure, of course. So what is the main program? Is it a particular time length, and also how do you keep people engaged? Once you actually get them engaged,
get them engaged and then keep them. Yes, yeah. Exactly. We have 3 progressive levels of exercise. And so there's exercise, there's education, and there's support. And in the exercise, there's different tracks. So there's different joints. And then within each joint, there's different tracks, right? Because you well know you don't give the same exercises to everybody with knee pain, right? You're going to individualize based on that subset of pain. Within each track, there are 3 progressive levels, and we move.
Can I stop you for a second? Sorry. How are patients funneled into each track? Does everybody start at the same point, or is there some sort of assessment?
Right. So at the very beginning, when somebody first engages with us, they answer an online screening.
Yep.
And we're looking at medical risk. So is there a medical reason that would indicate you really should not be using a digital program? You should go see your provider, be it physical therapy, be it your MD, in person, before engaging with the digital solution. For some joints, back pain, for example, we're looking at catastrophizing fears. So if we identify somebody as high risk, we will refer them out.
Sure.
And for those, we refer into in-network care to our clients. So with some clients, we're referring into TelePT, for some into physical therapy, for some into telebehavioral health, et cetera. So it's really dependent on that network of our client. And then the other thing that screening does is it gathers those baselines and asks questions about the pain that would funnel you into those particular tracks that we're talking about.
Gotcha. So it's like AI triage essentially?
It's AI triage, exactly. And so what we find is that across our lines of business, 80% of people who complete the screening we consider appropriate for Kiio. So they will get immediate access to their personalized care program. And the 20% that either have a medical or behavioral health reason that we feel they should see a human provider, be it telemedicine or be it brick and mortar, we refer out.
Sure. So once someone starts one of the tracks, right? They start the program and they're how do you keep them engaged?
Yeah, many ways. So this is an app-based program. So they are getting encouragement, views into their progress, in-app messages, etc. in the app. We also, for people who are not engaging, we will send them some surveys. We will reach out with our human team to engage them. We will send them emails. So a variety of different channels if somebody is not engaging optimally.
Got it. What are the biggest challenges in terms of, like, I guess, keeping people engaged and getting them to finish a program? I mean, I know some people just fall off. Anything else?
Those are really, so one thing that we're focusing on now, we use AI and we use the information that we get in screening, as well as that richer profile that you're building as people are providing you more feedback digitally while they're engaging to personalize the program. All right. So if we're going to personalize your messages, personalize the imagery we show you, et cetera.
What do you mean by that? Personal?
Well, for example,
like by cultural or gender or?
Well, we do by gender. So if you are a male, you'll be following along with a male avatar who's.
Can I request a female avatar?
You could request a female avatar if you wanted to.
Awesome. By the way, that's the dumb question that every guy is gonna. Sorry.
But then mostly, what I was referring to is, what motivates you may be different than what motivates me. Right. So if you tell me that what you really want to be doing is getting back to doing more, playing more basketball, versus somebody else tells us in screening that they want to play with their grandkids more, somebody else says they want to be, walking their dog, whatever. Some of the imagery that we use will tie into that motivator for you.
Very smart. I like that. Yeah. I mean, all I'm thinking about it as we're having this conversation is, should I just hang up my PT license? I have other questions, but like, what is the effect of technology? What do you see as the effect of this technology on patient care in the next few years?
Yeah, so I think digital in its full spectrum, right? So this includes solutions like Kiio, where we don't consider ourselves a one-to-one clinical solution, right? We are not, and unlike some digital solutions that are, some combine it, right? So some is pure TelePT. Some are combining kind of digital, but also sort of attempting to be that clinician as well.
Right.
We don't view ourselves as competition to providers in the same way that those solutions will, right? So we're provider agnostic when it comes to referring out of Kiio. We do not view ourselves as replacing physical therapy. And we were built by physical therapists, right? When it comes to the protocols. And I'm curious,
no, this is good. This is good.
But there are people who need to see an actual person.
This is the other side of a conversation we have all the time. And the conversation is that PTs need to be aware that Kiios exist. You are not here to steal from physical therapists. You're not here to replace physical therapists, but you're a really good solution. Because
whether you want to or not,
whether you
might take some territory away.
Right, exactly. I mean, what you're doing, and I know you have competition. You're not the only one your Kiio's not the only company doing something like this. but this is a very viable, scalable, apparently effective solution to musculoskeletal pain. And PTs tend to think of themselves as the one and only solution to musculoskeletal pain, and we're not. I mean, we're good, we're a really effective one, and we're great for the 20% that need us. But until recently, we've been the only game in town, kind of, for like what we do. But you're going to cut off a lot of patients at the pass, and kudos to you for that.
But at the same, this kind of comes up with like some conversations we had in the past about like, I'm of the mindset that physical therapists have done a lot of great research. I think it was, the 80s, 90s today. I sound like one of those commercials, best of the 80s, but I feel like there's so much data, but the actionable items are just starting by the Kiios and the digital health solutions, that there's so much data that we know what the solution is. We know we can help people. And so the Kiios out there just taking all that data, putting into digital solutions, and here we are. So I think that's where I'm like, we've done a really good job to help the population now. I'm okay that, digital solutions are doing a better job of the brick and mortars, of the past. I mean, I don't think they're ever going to go away. I don't think our profession is ever going to go away.
Correct.
We need humans, but we've done such a good job of collecting data about the human body movement that here we are. Yeah. And a lot of people are going to be nervous,
Exactly. The digital solutions are built off of that research, those protocols, that work that shows that movement, education, exercise, that's the first line defense, the first line therapy for musculoskeletal. I guess we would see it as enabling physical and occupational therapists to operate at the top of your licensure.
Yes.
To reduce access to care issues, and quite frankly, for providers in a value-based arrangement, it can be part of the solution potentially.
I'm sure you've been to conferences. Like, what do you say to those people? I'm curious. This is the first time where it's like, we don't have to answer this, but Lydia, like, who will say that, or have been skeptical, or being like, you can't take away our jobs, or you can't do what we can do with our hands. And what is your rebuttal? I'm very curious to what you say or have to say about that. I'm sure you have colleagues that are maybe against it or don't believe that it's a viable solution, but like, what do you say to those people?
So to be honest with you, we haven't had a lot of pushback. We have physical therapists referring into Kiio. We one of our very first health plan client, Quartz Health Solutions, they're provider owned. They're owned by UW Health. They're now owned by Gunderson as well. We worked with UW Health Physical Therapy as we set up the program for Quartz.
I can introduce you to a few physical therapists who will give you pushback.
Okay.
Go on Facebook. Just spend a couple of minutes on there.
Yeah. So I would say healthcare is changing, right? We're all about better access, about better outcomes, about better care. These are complementary modalities. Yes, there are some patients that may benefit from a purely digital solution that may take some business away from physical therapists, but gosh, musculoskeletal issues are not on the decline. They're on the increase, right? So there are plenty of patients for all.
But the equation is changing on the supply side. Okay, meaning that there's been this narrative in the PT space since I've been a PT for 25 years, that aging population, increased demand and need for physical therapists. There'll always be a job for a PT, right? And there'll always be a lack of PTs. We'll never have enough PTs. You're helping resolve that problem, but also changing the equation for PTs. And yes, now they will be forced to practice at the top of their license, or top of our license. But a lot of PTs and enterprise PT companies have gotten and continue to get fat on practicing below the top of their license, meaning hiring lesser quality or less capable staff, even handing off some patient care to techs or people who may or may not be licensed, things like that. And, you know, that those kind of situations, those patients should definitely, I think, can be managed much more efficiently. And you're creating efficiencies. And to Adrian's point, by the way, about data, we're in defense of PTs on Kiio, the Kiios of the world using our data. We're PTs. We don't know what the hell to do with the data. So we've been collecting all this data and, you know, doing this research. We're not engineers, software technicians, so we've never really known what to do with it. And, you know, now hopefully it's being used very effectively. And to that point, Lydia, can you speak to like data collection, how Kiio uses data to maybe in the initial development and then going forward, what your plans are with the data that you're collecting now?
Right. So obviously, as you well know, everything we do is covered by HIPAA and covered by the contracts that we have with our B2B clients.
Mm-hmm.
We are collecting the screening data from members, right, as they complete their screenings. If we are in a health plan type of situation, we're able to provide member level data back to the health plan, which actually enables them to provide more complicated case management to certain folks with, you know, significant comorbidities. So that helps get the right level of care to the patients. And then we are also collecting the clinical outcomes and the satisfaction outcomes with every interaction that the people are having. So we're seeing, did you engage? How long did you engage for? How many times did you do the exercises? Did you do this exercise versus that? Which one did you like better? All these types of things that builds into how we modify the programs and kind of the product features that we put in, because what we're really trying to do is make it as simple and as simple, engaging, and easy to use for the member, right? Because that's what drives engagement. And then looking at what actually is effective.
So you're working using your data and feedback that you get to improve your product, and essentially also to obviously sell it to other companies, other clients. And
we don't sell it to anybody. So the only way we're able to, so if the contract is covered by a BAA with a health plan, right? Similarly to how you would provide information about that patient back to the health plan, Kiio will provide information about that member back to the health plan. We don't to employers, right? It's aggregate data to employer.
Got it. Yeah, that's not what I was implying. I was suggesting that you're actually collecting data to use for marketing, essentially. Meaning like your aggregate information, you can now say, you know, we reduced injuries 50% at all of our, you know, with all of our previous clients, and, you know, help all the data that you shared with us already. I mean, that's huge. That's great marketing information.
Exactly.
But
so in the aggregate, we can use our book of business to say, this is what we have achieved.
Got it.
Or this is how we compare.
Yeah. To your point though, about collecting individual data, can you speak on that a little bit more? Because I you know, everything you said is in line with what we would expect. Can you give us how that works from the vendors side?
How we collect data.
So what you do with it, why should patients or members or employees feel secure about how you manage their data?
Yeah, so Kiio has just submitted our high trust certification. So that has to do with how security and how we treat data, our privacy policies, et cetera. That's the highest standard for digital security. We have passed the security checks of every large health plan with whom we work, and trust me, those are rigorous. We make it very clear to every member in our privacy policies, in the terms of use, that all of the information is covered by HIPAA, that we are not able to sell their information. We are not able to disclose their information except in the ways that's expressly outlined in the terms of use. So for example, in the terms of use, it says if your sponsor is a health plan, your data can be provided back to that health plan, the same as it would be with any provider that you see. But beyond that, Kiio, all your information is confidential. We'll use it in the aggregate within Kiio to improve the product, right? To take member feedback into account as we're improving the product, but we will never sell data.
That's great. Adrian, comments?
I mean, it's something we've talked about in the past, right? About like the data is a new currency, and especially for musculoskeletal or healthcare, which kind of leads me like, the future, what's like the future hold of musculoskeletal care? We're going to have all this data about, everybody's movements, and we'll know even more about how to prevent injuries or improve rehab outcomes. So yeah, it kind of goes in line with our conversations in the past about, is this the currency of musculoskeletal, care?
Well, Adrian, I mean, I think what you just said is spot on, right? Because a digital solution is able to capture all of this data about the efficacy of particular interventions, particular combinations, and when analyzed in the aggregate, you can get information about what protocol may work better for what subtype of person, not only based on injury, but based on what's going to make somebody engage and actually, right? Because whether it's a physical therapist giving the exercise or whether it's a digital product giving the exercises, if the member or the patient isn't following through, it isn't any good, right? So are there particular ways to engage with particular groups of people that are going to be more efficacious, right? Are there particular cadences in which you deliver content that's going to be more efficacious? And I think that can be extremely interesting, extremely powerful, and benefit all of healthcare.
Do you happen to have any like not case studies like on paper, but any anecdotes of that situation, like you guys, or if you're allowed to share it, like we found that this subtype of people do better because of this, or they're more engaged or less engaged? I kind of gave an example like a couple of years ago. It's like if you were born in Idaho, maybe your back pain is going to be less. I don't know. But do you have any interesting stories?
Yeah, I mean, I guess a couple come to mind. We did an initiative with one of our health plan clients, Children's Community Health Plan, that serves Medicaid populations and marketplace populations. And we really tried to do a concerted effort to make them aware of these benefits during COVID, because both the health plan and Kiio understood these are more vulnerable populations. They're disproportionately suffering under COVID, and we had really great response to that. So that was a good success story. I guess another anecdote would be that and I'm curious to know in your practices what you see, but while folks may think the 18-year-old male is the easiest to engage with digitally, we've actually had some of our very best engagement in the elderly population. So Medicare Advantage, for example, people 65 to, we've had people up to, I believe, like 97 years old using Kiio. And when you can give them something really simple that is going to be there in their pocket, guide them, make it really easy to use, then they don't have to leave their house. That can be really meaningful. And yes, that population may call our tech support a few more times. They, may need to figure out the volume on their iPhone or how to get to the App Store. But then they have a conversation with our tech support about their grandkids, and it's this sort of bonding experience, and you get even better engagement. So I guess those would be a couple anecdotes.
I like it.
That's cool. Yeah, I think it's the younger generation is harder to impress because they're seeing even more and more technology. So when I was briefly for a year with a VR company startup, and we had a lot of therapists saying, older population is not going to like this game. And turns out the studies on LinkedIn and all the studies in VR and Google and Oculus saying that people over the age of 60 actually really enjoyed it. It was like really, really the older population, the very young population, everybody in the middle is just like, whatever, it's not that great. And I think it is because, 18 to 40, 45, grew up with, entertainment systems, Nintendo, and now, computer graphics and movies. So you got to impress them.
It's hard to impress them.
Hard to impress them and keep them engaged. And it's just, everything's really fast. So it makes complete sense, you know, but at least you have like the, you know, the actual data and the factual evidence to prove that.
That's funny.
So I'm curious what you're doing for the 18-year-olds.
Well, we did an app refresh, making sure the app is modern. We've got another rebranding and refresh coming up. So, again, we try to focus on an intuitive interface that's easy to use. That's what you are going to expect the interface to look like. You shouldn't have to learn how to use Kiio, right? It should just be intuitive how to use Kiio.
Sure.
That's mostly what we focus on.
My mom stayed with us this past weekend, and every free moment she had, she was playing games on her iPad or her phone. I was like, you've been telling me my whole life to, get my face out of the television or computer, and now the tables have turned. You were talking about data, so this is kind of a nerdy question. I'm not really sure I even know how to ask it, but are you using any sort of big data? Like, to what levels of correlation are you trying to, I guess, connect types of patients and types of care?
Yeah, that's another one of those roadmap need to focus on this. We've got the data. Have we done everything with the data that we should be doing with the data? Frankly, no, right? No.
Got it.
We haven't yet, but again, having that and having it in your sites that's something that you want to
obviously
more on.
You're aware of it, you talk about it. How far into the future is that for Kiio and other applications out there?
Yeah, it's not very far into the future, right? So we're using it now to tweak your program, right? To customize it more to you. We're using it on a more aggregate basis to improve the product, but really pulling into kind of the things that we were talking about earlier. Well, maybe a year.
Okay. Now, I don't really know what big data even means, and I don't want to put you on the spot if you don't have a good explanation or definition of it, but can you explain it to us or our audience?
I'm not going to attempt to explain big data, since I think that means so many different things to different people, just like AI has different levels, right? One of the things that we're working on, so we get claims from health plan clients in certain cases. We're not getting it to on upfront. In other words, we're not taking or approaching members because of their claims history. We're making it broadly available, but then we're looking at claims later. So a data warehouse, though, where we're able to more precisely marry Kiio's data with that claims data in order to draw inferences and see correlations, that's something that we're really excited about.
Gotcha. So if I understand correctly, you might see claims that say a patient is had like a cardio exam, or is taking some meds for anxiety or something like that, and would it be possible to tweak your treatment based on that, or your approach to that patient based on that?
Potentially, right? What's going to work best for that patient. The other thing that I think is really exciting in the future is the predictive modeling, right? And so
that's right. That's what I thought you were referring to. Yeah.
Well, you're probably referring to taking multiple things into an account.
Right.
So right now, what we're taking into account is when we're customizing your care program is what you're telling us in screening. We're not taking outside data into that. So I think there's that possibility, but then I think there's also the potential to work together with predictive modeling companies, not necessarily build that on your own, but to provide, because when you, as you well know, when you provide just-in-time treatment or just ahead of time treatment, that's where you can kind of really move the needle.
Right. So what else does Kiio have planned for the next 5 to 10 years? You mentioned a roadmap. What else on your roadmap?
Well, we began back so we first launched this product in the beginning of 2017 with our first health plan client, and it was back pain. And so this year we rolled out knee, neck, and hip. We've got shoulder coming out in Q3, and so we're kind of broadening broadening the range of conditions that we treat. So that's one thing. We launched a direct to consumer in a partnership with Walgreens Find Care earlier this month. So that's our first foray into direct to consumer. And then really what we're focused on is, leveraging that AI to hyper personalize, right? To drive engagement by making it even more and more and more personalized to a particular individual.
That's great. That's very interesting to me, and other people have said it to me that they would love if they had a personal avatar to tell them to do their exercises. Meaning, wake up in the morning, you're drinking your coffee, and you get a message on your phone, and it's your guy telling
Right.
you, we're going to do some hamstring stretches right now, or we're going to do some standing back bends. And people have literally said that to me. That would be so easy. So sounds like that's what you're doing. I mean,
that's what we're working on. Absolutely. And we have
awesome.
it to a certain extent, but we keep raising the bar.
Yeah, that's great. We've asked you a lot of questions today. Do you have any questions for Adrienne and me?
So I will ask you two questions, if I may. I will ask you how you feel COVID has changed the landscape in PT. And I would secondly ask you the same question that you just asked me. What do you think is really exciting in the space, and what are you focusing on in the next year?
Great. Adrienne, you go first.
Oh my gosh, I already forgot the first question.
You can answer the second one.
Pandemic, no, it was pandemic, right? COVID. Well,
Yeah.
I mean, to be frank with you, I think COVID changed a lot. Everyone went to telehealth and realized that digital was important, but then I think we reverted back. So not much has changed to wanting to go in person. I think it's partly because physical therapy is an experience. It's a human experience that just by seeing your therapist, people feel better, and so that's that. And then, so my journey has always been to entertain. For me, it's entertaining engagement, right? Entertaining people changes their behavior. And we've seen case studies on Netflix even in the past with Grey's Anatomy. We saw it in the game chests that were purchased, Marie Kondo tidying up. So my passion has always been to entertain, to change behavior, but doing it in a way that we educate as physical therapists and movement experts how to do it. So that's what I've always been doing for a decade, and I'm still doing it. And that's my goal for the next year to work on.
I love that, because healthcare is not fun enough, is it?
Right.
It's not in general a fun experience.
Right. And so same thing with you digital. I was working in VR. I'm still working on the concept. So it's the whole entertainment business. And with technology, for me, it's to create the same thing in a 2D format and a virtual reality format as well. So gaming and experiences and having fun, to your point.
Adrienne, plug your projects. Gross Anatomy.
Gross Anatomy right now is a proof of concept. The web series is out, youtube.com/Gross Anatomy. And it's really like a sitcom. It's Dr. Dennis is a field physical therapist, and he ends up having to teach a bunch of rowdy GED students anatomy. And then the second project that's kind of in tandem right now, the proof of concept is kind of finished and looking for more funding. So I'm in the same boat as you, like pitching and things like that, is a virtual reality game. So the first one is Dizzy Bird. So it's pretty much a neck proprioceptive game where you're looking for your mom, but you have to guide the bird using your headset, and you're in this whole wilderness, and there's bosses and there's a storyline. So everything I'm creating has a narrative to it, but in order to engage, you have to learn anatomy, or you have to do anatomy and movements to get your outcome.
Very cool.
Yeah.
Very cool.
I'll take a stab at your questions too, Lydia, and I'll make it quick.
Yes.
First off, the biggest thing about COVID and the pandemic is that it knocked down walls. It forced everybody to take a step back and just reevaluate how they're going to take care of themselves, but also health plans and payers and everyone else, how they're going to manage their systems, because we all had to shift and adjust. And it just, typically a moment like that is required, or people are very comfortable in their old ways, right? So something like telehealth was gradually building before the pandemic, but no one really, it just wasn't, it shifted forward 5 years in terms of utilization in a matter of months. And I partly agree with Adrian that PT is an experience as you walk into a clinic and all that, but it also opened the door for the future of care. PT is going to be a little bit behind, but healthcare in general, the numbers are pretty staggering with how much utilization and adoption of telehealth is used now versus a year and a half ago. And that's not going to go backwards. It's just going to continue to progress as people get more comfortable with it and actually demand it, because the access that that remote care has provided it's a game changer. So I think that's the major step forward that's happened. I also think what's happened is healthcare systems and payers have recognized that they need to get more. Well, they need to adjust their payment programs and systems and more value-based. It just makes more sense, particularly in something like PT where we're getting paid per procedure. It's so silly. It's so silly because PTs are basically incentivized to do more, right? To treat more when we can be more efficient. And if we're incentivized to do that, watch how fast outcomes change and recovery times change and all of that. And that's been shown in the studies where it's going on.
Right.
I forgot your second question.
Oh, what you're excited about and what you're focusing on?
Well, that's really it. I mean, I guess it's things along those lines where I'm excited about the adoption of newer models and being more efficient in patient care. And I think the most important thing is really to get patients more involved in their own care and be more healthy in general. And there's so many initiatives out there that are not necessarily traditional medical. They are things like Kiio, things like Mirror, things like Peloton, and self-guided care. That's in nutrition and psych care also. I mean, so many things like that. Nothing else more specific except we get all geeky about some technology, tracking technology and other things that are out there. Which I actually forgot to ask you about this. Is there any plan for Kiio to utilize any sort of scanning or feedback or Adrian, what's the term I'm looking for?
Motion tracking.
Motion tracking or motion like a Connect or other technology?
Right. So I'll answer that in a couple different ways. So currently, our focus is really on ease of use. And so we began as a sensor company. We have a clinically validated sensor. It's actually still being used in a study to predict injury and chronic tendinopathy that we're working on with University Miller School of Medicine in Miami, UW system, and the Department of Defense. But we intentionally are not using that in this digital product because we get great outcomes without it, and we want ease of use. We're also not using motion tracking to guide exercises because, again, ease of use, if you have to have your phone set up at a particular angle, particular distance, that is not ease of use. If you don't have it set up correctly, you're actually giving incorrect feedback back. So we focus instead on getting you the right exercises and really clearly guiding you through it, both visually and audibly. We're also not using it for range of motion, although we are using motion tracking for range of motion in that other project that I was telling you about. The reason is that in the current product, it's not really a rehab product per se. In other words, it's more preventative, chronic, or acute on chronic. So what we care about is not so much your range of motion, but whether you're able to perform the functional activity that is personally relevant to you, right? So that's what we're tracking for function. If Kiio moves more into the prehab rehab space, in addition to what we're currently using, then we might use technology, we might pull that other technology we have into the current product. Does that answer your question?
Absolutely. And I have to say, I was just, as you were answering me, I was thinking, you've answered a lot more questions than I even thought I was going to ask. So great job. I mean, this was a really interesting conversation. I mean, I didn't I have to be honest, I didn't really know what we were going to talk about today. I wasn't sure.
Well, this has been fascinating for me too, a great conversation.
Cool.
So I appreciate the questions.
Absolutely. And I commend you and your team for really putting together what sounds like an amazing product. Where can people see a demo or check out Kiio?
Absolutely. So come to Kiio.com, KIIO.com, and you can reach out there.
Great. And if people want to get in touch with you?
You can find me on our website, but my email is LZeller, ZELLER @Kiio.com.
Great. Lydia Zeller, this has been an excellent conversation. Thanks for taking part today. And Adrian, great job as usual.
Daniel and Adrian, thank you as well.
Yeah, my pleasure. Thank you for joining us on the TelePT Connections podcast. We'll see you next week.